Many people hear the word fatty liver and immediately think of alcohol. They assume liver damage only happens to people who drink heavily. So when they are told they have fat in the liver, their first reaction is often confusion. I do not drink much. Sometimes I do not drink at all. So how could this be happening to my liver? This question comes up again and again, and it is the reason many people misunderstand what fatty liver really is. There are two main conditions that often get mixed together: fatty liver disease, that is related to alcohol, and fatty liver disease, that is not. On the surface, they can look similar, but inside the liver, the story is very different. Let us slow this down and look at what actually separates these two conditions. Fatty liver disease simply means that fat has accumulated inside liver cells. That is the basic definition. The liver normally contains a small amount of fat. That is normal. Problems begin when that fat builds up beyond what the liver can safely handle. When this happens, liver cells start to change. They become stressed, they become inflamed, and over time, they become vulnerable to damage. Now here is where the confusion starts. Alcoholic liver disease and non-alcoholic fatty liver disease both involve fat in the liver. That is where the similarity ends. Alcoholic liver disease develops because alcohol directly alters how liver cells process fat. When alcohol enters the body, the liver treats it as a toxin. The liver immediately shifts its priority to breaking down alcohol. While it is doing that, normal fat processing slows down. Fat begins to accumulate inside liver cells. At the same time, alcohol metabolism creates toxic byproducts. These byproducts increase oxidative stress. They damage cell membranes. They disrupt mitochondria. They weaken the liver's ability to repair itself. So, in alcoholic liver disease, alcohol is the primary driver. It pushes fat into the liver, and it directly injures liver cells at the same time. Non-alcoholic fatty liver disease works very differently. Alcohol is not the trigger. Instead, the problem begins with how the body handles energy. This includes how it handles sugar, how it handles fat, and how it responds to insulin. In non-alcoholic fatty liver disease, the liver is overwhelmed by incoming fuel. Too much glucose, too many fatty acids, too much energy arriving without enough demand. The liver tries to store this excess energy as fat. At first, this is a protective response. The liver is trying to buffer the system. But when the overload continues day after day, fat builds up faster than the liver can process it. Over time, liver cells become enlarged, their internal machinery becomes strained, and inflammation slowly develops. This is why many people with fatty liver do not feel anything at first. The process is gradual, quiet, and largely invisible. Now let us address one of the most common misunderstandings. Many people believe alcoholic liver disease only happens to heavy drinkers, and that non-alcoholic fatty liver disease only happens to people who are overweight. Neither of these assumptions is fully true. Alcoholic liver disease can develop with moderate drinking in some people. Genetics matter, sex matters, liver sensitivity matters. Two people can drink the same amount. One develops liver damage, the other does not. The same is true for non-alcoholic fatty liver disease. Some people develop it without obesity, some develop it with normal blood sugar, some develop it despite being physically active. This is because fatty liver is not about one factor. It is about metabolic load. How much energy is entering the system, how efficiently the liver can process it, and how resilient liver cells are over time. This brings us to another important difference: the pattern of injury inside the liver. In alcoholic liver disease, inflammation tends to be more aggressive earlier. Alcohol directly irritates liver cells. The immune response is stronger. Scar tissue can form more quickly, and progression can be faster if drinking continues. In non-alcoholic fatty liver disease, progression is often slower. Fat accumulates first, then mild inflammation develops, then, over years, scarring may slowly appear. This is why many people live with fatty liver for years without knowing it. Blood tests may be normal. Symptoms may be absent. Daily life feels unchanged. But this does not mean nothing is happening. It means the liver is compensating. Another key difference lies in how doctors approach diagnosis. When a doctor sees fat in the liver on imaging, the first question is often about alcohol. This is not judgment, it is clinical reasoning, because treatment paths differ. If alcohol is the primary cause, reducing alcohol intake becomes central. If alcohol is not the cause, then metabolic health becomes the focus. This includes insulin sensitivity, triglyceride levels, liver fat export, and energy balance. Doctors are not simply labeling, they are trying to understand the driving force. There is also a difference in how reversible these conditions can be. Alcoholic liver disease can improve significantly when alcohol exposure stops early. The liver has a strong capacity to heal if the insult is removed. Non-alcoholic fatty liver disease can also improve, but the process is often slower because the drivers are woven into daily metabolism. Sugar intake, fat intake, muscle activity, hormonal signaling. These are not single switches, they are systems. This is why quick fixes rarely work, and why many people feel frustrated. They try one thing, then another, without seeing clear changes. It is also important to understand that these two conditions can overlap. Some people have both. Moderate alcohol intake combined with metabolic stress. In these cases, liver injury can accelerate. The liver does not separate causes, it simply responds to total burden. This is another reason clear labels matter. Not to assign blame, but to reduce total strain. Now let us talk about symptoms. Alcoholic liver disease may produce symptoms earlier. Fatigue, abdominal discomfort, loss of appetite. But even then, symptoms are not always dramatic. Non-alcoholic fatty liver disease often produces no symptoms at all until later stages. This is why relying on how you feel can be misleading. Feeling fine does not always mean the liver is unaffected. It means the liver is still coping. One more difference lies in public perception. Alcoholic liver disease carries stigma. Non-alcoholic fatty liver disease often carries confusion. People feel embarrassed, or defensive, or dismissed. Neither response helps. The liver does not respond to guilt. It responds to reduced load and improved support. Understanding the difference between these conditions helps remove fear. It replaces assumptions with clarity, and clarity allows better decisions. If you have been told you have fatty liver, the most important question is not who is at fault. The most important question is what is driving fat into the liver in your case. Alcohol, metabolic overload, or a combination of both. That answer shapes everything that follows. And this brings us to what matters most going forward. Fatty liver is not a single disease. It is a pattern, a signal that the liver is handling more than it can comfortably manage. The earlier this signal is understood, the more options exist. In the next video, we will slow this down even further. We will look at how fat actually builds up inside liver cells, step by step. Not as a diagnosis, but as a process. Because when you understand the process, the condition becomes less frightening and far more manageable.